Let's dive into pharmacology for EMS professionals. Imagine we give you a list of statements and ask which one is true about the mechanisms of action of epinephrine and atropine. Would you know the answer? By the end of this video, you will. Let's get started. First, every medication has three names. The chemical name is mostly for the lab. For example, acetaminophen is the chemical name for Tylenol. The generic name is often seen on medication lists and pill bottles. The brand name is what patients often recognize, like Tylenol. Now, let's talk about drug cards. Here's what a typical drug card includes. Generic and brand names. Class which tells us what the drug does, like antihypertensive or antipyretic. Mechanism of action, which is how the drug works in the body. Indication, which is why the drug is given. Contraindication, which is why the drug is not given. Understanding the mechanism of action is crucial. For example, if a drug increases heart rate, we know it can be used when a patient's heart rate is too low, but not when it's already high. We also need to consider side effects, dosage, and the route of administration, IV, IO, oral, intramuscular, etc. Next up, let's talk about the sympathetic and parasympathetic nervous systems. Think of the sympathetic nervous system as the body's fight or flight mode. Think of running away from a bear. Your pupils dilate, heart rate and blood pressure go up, respiratory rate increases, and digestion slows. Sympathomimetics are drugs that mimic the sympathetic nervous system. Sympatholytics are drugs that inhibit the sympathetic nervous system, leading to parasympathetic effects. Think of the parasympathetic nervous system as the body's rest and digest mode. Think of winding down before bed. Pupils constrict, heart rate and blood pressure drop, respiratory rate slows, and digestion increases. Parasympathomimetics are drugs that mimic the parasympathetic nervous system. Parasympatholytics are drugs that inhibit the parasympathetic nervous system. While understanding these systems is essential, it's also crucial to grasp how different drugs interact with receptors in the body. This brings us to the concepts of agonists and antagonists. An agonist is a drug that activates a receptor. An antagonist is a drug that blocks a receptor's action. Alpha-1 receptors cause vasoconstriction when activated. Beta-1 receptors increase heart rate and contractility. Beta-2 receptors cause bronchodilation. Beta blockers end in olol and block beta receptors. These can lower heart rate and blood pressure, but might not be suitable for patients with asthma due to potential bronchoconstriction. Epinephrine is a sympathomimetic acting on alpha-1, beta-1, and beta-2 receptors. Atropine is a parasympatholytic that blocks the vagus nerve, reducing parasympathetic activity and increasing heart rate. It is used for symptomatic bradycardias because it raises heart rate by lowering parasympathetic response. A solid understanding of pharmacology is essential for EMS professionals. By mastering the different drug names, classes, and mechanisms of action, you can make informed decisions in the field, ensuring the best care for your patients. Keep refining your knowledge and skills, and you'll be well prepared to handle any medical situation that comes your way.
Click the link in the video's description to download EMS Pocket Prep and study any of our 7 EMS exam offerings. Pocket Prep is a mobile, quiz-based study platform designed to provide effective, engaging, and affordable study material for a wide range of certification and licensure exams. Download the app and start studying for free today.